Hi everyone. Today the topic of our discussion is greater omentum. The greater omentum is a large fold of the peritoneum which hang down from the greater curvature of the stomach. As we can see, this one is the stomach and this one is the greater curvature of the stomach. From this greater curvature of the stomach, the fold of peritoneum is hanging down till the coils of intestine, and this large fold of peritoneum is called the greater omentum, and it contains variable amount of fat in it, and it has four layers. The first layer hang down and it becomes fold back upon itself to form the fourth layer, and second layer hang down and fold back upon itself to form the third layer of the greater omentum. Talking about its contents include those arteries which supplies the greater curvature of the stomach. These arteries are the right and left gastroepiploic arteries. This one is the right gastroepiploic artery and this one is the left gastroepiploic artery. These arteries supplies the greater curvature of the stomach and involved in the contents of the greater omentum. Also, fat is also included in its contents. Talking about its function, greater omentum is basically a storehouse of the fat. It protects the peritoneal cavity against infection because of presence of macrophages in it. Collection of macrophages form small dense patches known as milky spot which are visible to the naked eye. Talking about its third function, it also limits the spread of infection by moving to the site of infection and seal off this area from the surrounding area. Therefore, the greater omentum is also known as the policeman of the abdomen. Greater omentum form a partition between the supracolic and infracolic compartment of the greater sac. So this was all about the greater omentum.